If you've been counting on your SNAP benefits to help stretch your fixed income, what I'm about to share could affect your grocery budget starting next month. Recent policy adjustments have trimmed SNAP allocations for the third time this year, and if you're receiving SSI, SSDI, or VA benefits, these cuts hit differently than they do for other Americans. Here's why. Your benefits are calculated using specific formulas that don't always account for rising food costs. And when SNAP gets reduced, there's no automatic increase elsewhere to balance it out. Right now, millions of seniors across the country are seeing smaller deposits in their EBT accounts, and many don't understand why or what they can do about it. The changes aren't being widely publicized, and the letters from your state agency might not explain the full picture. Whether you're in California, Texas, Florida, or anywhere in between, these modifications to the SNAP program are creating real challenges for people who've worked hard, served our country, or simply need support during their retirement years. Let me break down exactly what's happening, who's affected most, and the specific steps you can take right now to protect your household food security. Let me start by explaining what's actually happening with these SNAP benefit cuts, because the government notices you might have received don't tell the whole story. The reductions we are seeing right now are tied to something called the emergency allotments that were put in place during the pandemic. Those extra benefits helped millions of Americans afford groceries when prices started climbing and when many people lost income or faced unexpected expenses. But as of March 2023, those emergency allotments ended in most states, and what we are experiencing now in 2024 and into 2025 are additional adjustments to the standard benefit calculations. For folks on SSI, SSDI, or VA benefits, this creates a particularly tough situation because your income is fixed and predictable, which means every dollar counts when you're planning your monthly budget. The way SNAP benefits are calculated involves looking at your household income, your expenses, and comparing those numbers against federal poverty guidelines and maximum allotment charts. When you're receiving SSI, which currently maxes out at around $943 per month for an individual, you're already living on an extremely tight budget. SSDI payments vary based on your work history, but the average payment sits around $1,500 monthly. VA benefits also vary depending on your disability rating and circumstances, but many veterans are working with similarly constrained budgets. The problem is that SNAP uses these benefit amounts as countable income, and as they make small adjustments to the poverty calculations or update their deduction standards, your SNAP benefits can decrease even though your actual purchasing power hasn't increased at all. In fact, with food inflation running higher than general inflation over the past few years, you're likely finding that the same grocery trip that cost you $80 2 years ago now runs you well over $100. What makes this situation even more complicated is that different states administer SNAP differently, and they have some flexibility in how they implement federal guidelines. Some states have been more aggressive about recalculating benefits and removing people from the program who they believe no longer qualify, while other states have been more lenient during this transition period. If you live in a state like California or New York, you might be experiencing different timelines and different benefit amounts compared to someone in Alabama or Montana, even if your personal financial situation is nearly identical. The federal government sets the baseline rules, but states handle the actual administration, and that creates inconsistencies that can be really frustrating when you're trying to understand why your neighbor is receiving different benefits than you are, even though you're both on SSDI and have similar living situations. One aspect that doesn't get talked about enough is how these SNAP reductions intersect with other programs you might be using. Many seniors who receive SSI or SSDI also qualify for programs like Medicaid, subsidized housing, utility assistance through LIHEAP, or local food banks and meal programs. When your SNAP benefits get cut, it creates a ripple effect through your entire financial life. You might find yourself choosing between buying the medications you need and buying enough food to last the month. You might be visiting the food bank more frequently, which can be difficult if you have mobility issues or don't have reliable transportation. You might be skipping meals or buying less nutritious food because it's cheaper, which can then impact your health conditions and potentially lead to more medical expenses down the road. It's a cycle that's really difficult to break when you're living on a fixed income that doesn't adjust quickly enough to match the real cost of living. Let's talk specifically about SSI recipients because your situation is unique. SSI is a needs-based program, which means you qualify because your income and resources fell below certain thresholds. The monthly payment is designed to bring you up to a minimum income level, but that minimum is calculated using formulas that haven't kept pace with actual living costs in many parts of the country. When you're on SSI, you're typically automatically eligible for SNAP in most states, and those SNAP benefits often represent a significant portion of your food budget. Some SSI recipients receive $200 or more in monthly SNAP benefits, which can make the difference between eating 3 meals a day or having to skip meals regularly. The recent cuts might have reduced your SNAP allotment by $30, $50, or even $70 per month depending on your household size and state. That might not sound like much to someone with a comfortable income, but when you're living on less than $1,000 monthly, losing $50 in food assistance is absolutely significant. For SSDI recipients, the situation is slightly different but no less challenging. You qualified for SSDI based on your work history and disability status, and your benefit amount reflects what you paid into the Social Security system during your working years. Many SSDI recipients have higher monthly benefits than SSI recipients, but you're still dealing with a fixed income and you still face the same rising costs for food, housing, utilities, and healthcare. Some SSDI recipients might be right on the edge of SNAP eligibility, where a small change in the calculation formulas or deduction standards could push you out of the program entirely. Others might see their benefits reduced but still maintain some level of assistance. The frustrating part is that SSDI doesn't adjust monthly or even quarterly to reflect inflation. You wait for the annual COLA adjustment, and even then, those increases often don't match the real inflation you're experiencing at the grocery store. So when SNAP gets cut, there's no immediate way to replace that purchasing power. Veterans receiving VA benefits face yet another set of circumstances. Your disability compensation is based on your service-connected conditions and their severity ratings. Some veterans receive compensation for 100% disability rating, which provides a substantial monthly payment, while others might have lower ratings with correspondingly smaller payments. Many veterans also receive additional allowances for dependents or special circumstances. The VA benefit system is separate from Social Security, which means the rules for how your income is counted towards SNAP eligibility can be confusing. Some types of VA benefits are counted as income for SNAP purposes, while others aren't, and figuring out which category your specific benefits fall into requires careful attention to the rules. When SNAP benefits get cut, it can feel particularly unfair to veterans who served their country and now find themselves struggling to afford basic necessities during their later years. The timing of these cuts also matters more than you might realize. Many of the reductions have been implemented at different points throughout the year, which means you might have received a notice about changes back in February or March, then seen another adjustment in July, and now you're hearing about additional modifications that could affect your benefits in January or February of next year. This rolling series of changes makes it really hard to plan your budget because just when you think you've adjusted to the new normal, another letter arrives telling you that your benefits are changing again. For people who are dealing with cognitive decline, vision problems, or who simply find government paperwork overwhelming, keeping track of all these changes and understanding what they mean for your specific situation becomes a major challenge in itself. Another critical issue is that many seniors don't realize they might qualify for additional deductions or exemptions that could help protect their SNAP benefits from being cut as severely. There are deductions for housing costs, utility expenses, medical expenses, and dependent care that can reduce your accountable income for SNAP purposes. If you're paying more than half your income toward rent or mortgage, you might qualify for an excess shelter deduction. If you have significant out-of-pocket medical expenses, those might be deductible too. But here's the catch, you have to report these expenses and provide documentation, and many people either don't know about these deductions or find the paperwork process too complicated to navigate. Your state SNAP office isn't always proactive about telling you what deductions you might qualify for. They're often understaffed and overwhelmed, so it falls on you to ask the right questions and provide the right documents. The medical expense deduction is particularly important for seniors, but also particularly underutilized. If you're paying for prescription medications, doctor visits, dental work, eyeglasses, medical equipment, or health insurance premiums, those costs might be deductible from your SNAP income calculation. For elderly and disabled individuals, there's no cap on the medical expense deduction, which means if you have substantial healthcare costs, properly documenting and claiming those expenses could significantly increase your SNAP benefits or help you maintain eligibility when you might otherwise be cut from the program. The challenge is that you need to track all these expenses, keep receipts or bank statements showing payments, and submit everything to your SNAP office during your recertification process or whenever your benefits are being recalculated. Let's also address something that causes a lot of confusion: How asset limits work with SNAP eligibility. Many seniors worry that having any savings or owning their home will disqualify them from receiving SNAP benefits. The actual rules are more nuanced than that. Your primary residence doesn't count toward the asset limit, and neither does one vehicle. The resource limits for households with an elderly or disabled member are generally higher than for other households, currently set at $3,750 in most states, though some states have eliminated asset tests entirely for SNAP. If you have a small savings account or a modest retirement fund, that might not disqualify you at all. But again, understanding these rules and knowing how your specific assets are counted requires either doing significant research or speaking with someone who really knows the SNAP program inside and out. Transportation is another hidden cost that gets harder to manage when SNAP benefits are cut. Many seniors don't drive anymore or have limited ability to get to stores that offer the best prices. You might be dependent on family members, friends, public transportation, or senior transportation services to do your grocery shopping. When your SNAP benefits are reduced, you can't just decide to shop at 3 different stores to find the best deals like someone with a car might do. You're often stuck shopping at whatever store is accessible to you, and that store might have higher prices than the discount grocers across town. Some areas have grocery delivery services that accept EBT cards, which can be helpful if you have mobility limitations, but those services often have fees or minimum purchase requirements that eat into your already stretched budget. The social isolation aspect of these benefit cuts shouldn't be overlooked either. For many seniors, grocery shopping isn't just about buying food. It's one of the main times you get out of the house and interact with your community. When your SNAP benefits are cut and your budget gets tighter, you might find yourself shopping less frequently or spending less time in stores because you're anxious about overspending. Some seniors start relying more heavily on food banks or community meal programs, which provide vital assistance, but can also feel stigmatizing or might not offer the food choices that work with your dietary restrictions or cultural preferences. Others might start declining social invitations that involve meals because they can't afford to contribute a dish or they're embarrassed about their financial situation.